Alors bonjour à tous,
So hello everyone and welcome to this press conference to go over the situation of COVID-19 in Quebec. The Premier of Quebec, Mr. François Legault, is together with the Minister of Health and Social Services, Ms. Danielle McCann, as well as the National Director of Public Health of Quebec, Dr. Horatio Arruda. Mr. Premier. Hello everyone. I will start with the numbers. We have 84 new deaths for a total of 1,579. So my thoughts are with the families and loved ones of those victims. We now have 24,982 confirmed cases, an increase of 875. We have 1,581 hospitalized people. That's an increase of 23. 110 people in intensive care. That is a decrease of 5. This being said, we continue seeing in Quebec that we have two worlds. We have the world around the residences for long-term care, regardless of what you want to call them, and the rest of Quebec. And if you take the 84 new deaths that we have today, in fact, 75 of those took place in residences where long-term care is provided, and 9 where it was people who lived in their own homes, alone or with other people. So, of course, as you can see, the priority remains to care well to the best in those of the people who live in those residences for long-term care, such as CHSLDs. And I sincerely wish to thank people. This weekend, after my calling out to people, we had 11,000 new people who applied to come work full-time. And we have called back many of those over the weekend. Some have already been assigned, and we are confident that with those people, we'll be able to fill all the positions in the residences for the elderly. And quite honestly, there were names that were people better known than others. I'm thinking about Joanie Rochette, for example, who used to be a figure skater who studied in health, and the winner of the Super Bowl, Laurent Duvernay-Tardif. So those two people, together with hundreds of others, accepted going to work in our CHSLDs, even though it's difficult. So I have to say that this is a weight that is lifting off from my shoulders to see that finally we are filling all those positions and to be able to take control back in our residences for the elderly. So this touches me a lot. All those people who have the courage, because it does take courage to come and work in our CHSLDs. Thank you, thank you, thank you. This will allow us to concentrate more on the rest of the situation. As I was saying earlier on, 84 deaths, of which 75 in residences, 9 in homes. We also have a situation which is under control in hospitals. As I was saying, we have about 1,500 beds that are being used, but tomorrow we'll give you numbers. Even a part of those beds that are being used are occupied by people who should have been sent back to CHSLDs, but taking into account the situation in those establishments, we prefer keeping them at the hospital, despite the fact that they've already had the treatments that they had to have. So it can really be said that the situation is under control in our hospitals. Remember, we had freed up 7,000 beds, and we have 1,500, not even really, that are being used for COVID-19 cases. Of course, it was the most important condition to fill before even thinking about reopening schools and businesses, to take back or be sure that we had control in our hospitals, so to be able to care for all of our people, even start having regular activities again. So we'll start doing it in the course of the next few days and weeks. Of course, we are going to continue following the situation closely to see whether it remains under control as it is right now. So today I am announcing to you that if and only if the situation remains as it is right now, we will be reopening primary schools as well as daycares the 11th of May outside of the Greater Montreal area and the 19th of May in the Greater Montreal area, what we call the CMM, the Metropolitan Community of Montreal. So Montreal, Laval, what you call the 450 area code, thereabouts. So it's important, I had said so already, school will not be mandatory, so those parents who prefer to keep their children at home will not be penalized in any way. There will be work that will be done with the children who stay at home. Later, at 3:30 p.m., the Minister for Education as well as the Family Minister are going to be explaining to you more in detail how this will unfold. But it's important, and I've repeated, we wanted to announce things a bit ahead of time because we had to get things ready for the 11th and the 19th of May. But we will be following the situation. So if ever the situation should worsen or was not as expected over the next few days, we will readjust things. What is important here is gradually and prudence. So later, the Minister for Education will be explaining things to you, and we will be asking as much as possible to request of children to keep 2 meters away from one another. We know that it's a lot more difficult in daycares, and that is why we are going to be asking the educators to carry and wear a mask while they are in the daycares. As far as high schools are concerned, as well as CEGEPs and universities, they will not be reopening before the end of August. So in the fall, as usual. Why are we not opening up the secondary schools or high schools? Well, first, it's important that there be a gradual reopening. We've said it. So we are gradually reopening the primary schools, but we are going to be waiting for September for the high schools, CEGEPs, and universities. One of the reasons as well why we chose primary school rather than secondary school is that high school, CEGEPs, and universities, they use public transportation a lot more, and that poses extra difficulties to keep the 2-meter distance. And as well, and it is important to say it, it's easier for high school, CEGEP, and university students to follow remote classes with their teachers and professors. They've already started doing so, but we're going to be asking them to do so more. So to teach remotely. It's easier with this group than it is with people in primary school. Of course, this is an important decision, and over the weekend I was looking at what is being done elsewhere. I was looking at the results, at the predictions, and for me there are 5 reasons why I think it's important to reopen our primary schools as well as our daycare. The first reason is for the well-being of the children. It's important, especially for those children who have learning challenges, that they don't remain 6 months without having gone to school. We know what we call in the school jargon the people with attention deficits or learning problems or handicaps of any kind, dyslexia, attentive disorder, autism, etc. It is important that those children not be absent from school for 6 months. It's important that they be followed, and the teachers know them. It's those 20 to 25% of children. It's possible, depending on the choice of the parents, that certain of those students remain at home. So we'll be asking teachers to pay special attention to those children that have a harder time learning, whether they be at school or at home. and for the weeks that are coming up, as well as during the back-to-school period in September. So it's important that we pay attention to this. So first reason, therefore, for the well-being of the children who have to go to school, who have to continue learning, particularly those children who have difficulties. The second reason why we are reopening the schools, because the risk is limited. We've said it, the serious consequences for children, even for people less than 60 years of age, are limited. And I would like to take this opportunity to say, and later the two ministers will be able to explain it to you more in detail, the children who have health problems or parents who have health problems should keep their children at home. I think that it's important. Certain chronic diseases, for example, it's not time to go and expose those children who have health problems, physical health problems. It's not the time to send them to school right now. That's important. For the others, we consider that the risks are minimal. The third reason why we are making the choice of sending the young children to school and daycare is because the situation is under control in hospitals. So if ever there were children or teachers who became ill, we have all the capacity and the staff that is available to be able to care for them. And it is important that it remain that way. So it is important that it be gradual. So we're not going to open up primary and secondary school at the same time, to be sure to keep the situation under control in hospitals. Fourth reason, because we have the go-ahead from public health. This is not a decision that is made, off the top of our heads. It's science. Science is telling us that it is possible to go back to school if the situation remains under control for the 11th and 19th of May. And the fifth reason, I would say, is because life has to continue. Children, I think it's good that they see their friends again, that they see their teachers again. We don't think that there will be a vaccine before a 12 or 18-month period. The experts don't think so, not before 12 to 18 months. And I do not see children staying at home cooped up for 12 to 18 months. I think that life has to continue, and the situation, if we wait for the 1st of September, would probably be no different from the situation that we are in front of right now. But I want to really emphasize one thing. Those were the 5 reasons. So you saw that in those 5 reasons, the most important, those are the 5 reasons. And we don't have herd immunity in those 5 reasons. There are experts who believe that catching COVID-19 could immunize you. That's what we all wish, because otherwise it could be even difficult at some point having a vaccine. So that is what we wish. However, it's not proven. So we cannot make our decision based on that. But it would be a secondary benefit if ever it proved to be the case. So I want to be quite clear about this. We are reopening our schools for social reasons, as well as because the situation is under control, in particular in our hospital system. Now, of course, over the next few days and weeks, we will continue having cases as everywhere else in the world. And we will be adjusting our strategy depending on the evolution of things. So right now we have predictions. We see that the situation is under control. Tomorrow we'll be announcing a reopening plan for businesses that will be very gradual. So once again, we do not, whether it be in public transportation or generally speaking, we don't want to send too many people back into society at once. Why are we doing all this gradually? Well, for the same reason, to keep control in our hospitals and not have any overflow into our hospitals. I would like to end with my thanks. My thanks are first for the educators Those educators, since the very beginning, for 6 weeks, they have been caring for the children of healthcare staff. So I wish to really thank you. And also a big thank you for those teachers, because I'm told that there's a lot of teachers who have been communicating with their students throughout the past few weeks. Thank you. And a thank you ahead of time to all the educators and teachers who, in the next few weeks, are going to be with those children again after a period that was really special in our collective lives. So thank you ahead of time for the work that you will be doing over the next few weeks with our children. I would like to end by saying, I know that today and tomorrow, with the reopening plans for both schools and businesses, some Quebecers are going to have questions, are going to have concerns. And it's important to say that there is nothing that is mandatory here. Go at your own rhythm. When you're ready to go out, when you are ready to have your children go out first, don't forget to keep that good habit that will be there probably for many months to come, to always stay 2 meters away from other people. But go ahead, at your own rhythm. We don't want to rush anyone. So, courage. Hope is there. Thank you, everyone. English?
Yes, good afternoon. Today we announce our plan to reopen primary schools and childcare services. We've chosen not to reopen high schools, CEGEPs, and universities. This will limit the traffic in public transports, and we consider that primary school children will benefit the most from the remaining school weeks, especially children in difficulties. This reopening will be gradual. It won't be obligatory, so the children won't all come back at the same time. In the Montreal region, will reopen on May 19 if all conditions are met, and outside of the Great Montreal, it will be on May 11. We will analyze the situation every day and adjust if necessary. The watchword here is prudence. Tomorrow, we'll announce our calendar to restart sectors of our economy. It will be very gradual. The situation must be and must stay under control in our health system. Everybody will have to follow public health instructions. We must continue to keep our distances. To succeed, we must continue all our efforts. Thank you all.
Merci, Monsieur le Premier ministre. Alors,
thank you, Mr. Premier. We will now be starting the question period. Quebecers this morning who have been listening to the press conferences from Justin Trudeau, they heard a message that is pretty different from yours and have emitted many worries with this deconfinement concerning herd immunity. I know that you yourself have reservations, and it's premature to conjecture. There is no evidence saying that this protects you. The virus is new. We don't know if the antibodies do protect us, and we have to be extremely prudent. So right now there's a lot of Quebecers probably who feel torn between the message of prudence that you're sending out and the one that is much more moderate, if you will, from the Prime Minister Trudeau. What makes you say that your approach is the correct one? And in the absence of scientific evidence, should we not apply the principle of precaution? Well, first, I don't see much difference between what the federal government is saying and what the different provincial governments are saying. We had a long discussion last week, once again. We are trying to agree on a certain number of principles, and I think that we should be able to agree. So, yes, we have to be prudent. We have to reopen gradually. We have to make sure, amongst other things, that we are keeping control in our hospitals, that the situation remains under control, that we even continue and even increase the number of tests to be able to follow the situation as it evolves over the course of the next few weeks. But I have not felt much difference between the different provinces or with the federal government on the conditions for gradual reopening. For many weeks, you've been saying that you have the intention to increase the number of tests, that it is part of the deconfinement strategies. But when we look at the numbers of the past few weeks, it seems to even regress or even stagnate. Cécile Tremblay says that we have to screen massively, but right now we don't have what we need. If we deconfine and we can't test massively, there will be new infections. The fire is going to start over again. Since the beginning, we've had a lack of things, sometimes swabs, sometimes reagents. We need evidence. So what evidence do you have to give to Quebecers? Do you have any specific timeline? Do you have any specific targets or anything like that? Well, first, we are one of the places in the world where per million inhabitants we have been testing the most. Together with Germany, we test 3 times more than Ontario if we look at it proportionally. So we already are testing a lot, and we will be increasing the number of tests. And for me, it was one of the questions that I asked. Are we sure that we have all the necessary equipment for those tests? And I am being assured that yes, we do. And yes, over the next few weeks, we do want to go more on a random sample basis. In the past few weeks, as you know, we concentrated quite a bit in CHSLDs, and we want to increase the number of tests, and I think that it is the objective of Dr. Ruda. Yes, there were problems previously with the reagents and the swabs, but that problem has been fixed right now. We have a capacity that increased quickly to 15,000 tests, and when we have the new PCR, we will be able to go to 20 or 30,000 tests. So right now you have to understand that it is part of the deconfinement conditions that we have set up. And you will understand that we are looking exactly at what the literature is proposing to us. You know, these different worldwide organizations such as CDC and the World Health Organization, and we're following them very closely. So what we are presenting today is a scenario that we believe to be possible. Let's not forget that we're also looking at the epidemiology that is different. When we speak of Canada, it's one thing. Each province is different as well. And we can't do the same kind of deconfinement in the metropolitan area of Montreal as the other regions where they're cold. That's important. And it's a very important element that I want to tell the population. As soon as we start deconfining, there are people who could interpret this as being, since we're opening schools, we can start moving all over the place and going all over the place. No. Despite deconfinement, the population at risk remains at risk, and it is important to continue following this prescription. What does that mean? It means that we don't want people getting together, whether it be outside or elsewhere. It's now time to have parties or to have family dinners with the elderly. We're still going to have constraints with those populations who are at risk. It's annoying. It's too bad. We would like to be able to see them, but we cannot allow that people interpret deconfinement of daycares and schools and of certain sectors of activity that it means that everybody's deconfined and that we start again as if everything was over. No, it's going to be major. I told you that the flattening of the curve depends on the collaboration of everyone. We got it, but now, with the spring, with the beautiful weather, it's going to be difficult to stay cooped up. But we'll have to keep doing it because otherwise, this gradual, progressive operation is going to be cancelled out by population movements that should not take place right now. I dream of a vaccine. I dream of a treatment, but it's going to be lengthy. We're doing it right now because the same problem is going to be there in the fall, and it's true. And I want to tell you, it's not just infectious diseases. The state of people's mental health of young people, their learning conditions, the problems with mental health, violence that can be experienced within homes that we can't see right now, all of that is also taken into consideration when balancing out the risks. But the Premier knows it. We are going to be evaluating whether the conditions keep well. If they do not, if they go back, we'll go back as well. And if the population does not participate in the maintaining of this, we're all going to lose out and we're going to have to reconfine intensively, which in my mind, would be excessively negative. And I want to send that message because do not interpret the fact that we're opening schools or some kind of activity sector in the Bas-Saint-Laurent or elsewhere that everybody can start going all over the place. And particularly in the zone where there's active transmission in the greater metropolitan area of Montreal. Thank you.
Bonjour, Monsieur le Premier ministre, Madame McCann, Monsieur Arruda. Ma première question, c'est...
My first question, what will be the measures that will be set up in the classrooms to ensure that there, or rather to limit contacts? Will there be, for example, a limited number of children in the classrooms? Will there be suggestions of wearing a mask? You said for daycares, but in the classroom as such, what will be the conditions in the classrooms? Well, what we'll be doing is to make sure, first, we expect that not all children are going to be going back to school. Secondly, we have all the high schools that are going to be empty as well. So if ever we had a need of them, we could split up the children. But we want to make sure that there is a number of about 15 children per class, depending on the size of the classroom itself, but to be able to have a 2-meter distance between each child. Are you going to be testing in schools? Because there might be, to a certain extent, children that will carry. Perhaps they will be asymptomatic. Are you going to be conducting screening tests to see whether there is spread within the school? It's a possibility, it's clear, but it's clear, if we had outbreaks, if we had a teacher who got ill, developing symptoms, or a children that might develop symptoms, but we will be managing those cases, as clusters or outbreaks. Now, can it be done in schools? Yes, it could be in schools, but also in community. We could be testing, giving you an example, testing grocers, taking into account that they have been open for a long time. We will have a strategy that will be the best balance between the quantity of screening tests that we have available and the representativity of the data. Earlier you said that we were going to deconfine in schools if and only if it remains as it is right now. What does that mean, remaining as it is? And also I would like to know, what is the date of the dates based on, the 11th and 19th? As far as science and the modeling is concerned? Well, it's based on the epidemiological situation that is observed. As we were saying, it is, and now I want to exclude what we call the outbreaks in CHSLDs that change the image of community transmission. We know that outside of the Montreal area, there are almost no cases. There's not very active transmission, so we could start the activities again in those areas. If ever we realize that when we reopen, companies and others, there starts having outbreaks, perhaps not like in CHSLDs, but outbreaks on which we'll be investigating and controlling cases and contacts, where we'll be checking things out and doing tests. If we realize that our hospital capacity is no longer enough and that we end up with a lot of people in all the intensive care area and hospital beds might be used, then we'll have to slow things down. We'll also see, the next few days are going to be major. How will the curve of cases evolve in Montreal? Because right now it's kind of in a plateau. Is it decreasing enough so that we can think that a reopening might take place? So it's on the basis of the epidemiology. Of course, we don't want to reopen on the 24th of June during the summer period. We also wish to, in my opinion, we have enough signals that pediatrics are telling us that there's, a decrease of things being signaled to the DPG. There's problems with violence and mental health. Those are elements that are making us want to open things up more quickly, but we will not put in peril people's health. We want to remind you of that. We want teachers who are in good health, below a certain age to avoid complications, and in children, usually there is no major consequences. Everything is possible. It does not mean that there will be no other cases. It does not mean that it is not impossible that there might be cases and deaths concerning the circulation. But what is important is that this opening is going to be moderated, progressive. We'll be looking at it every day. We'll be applying our projection scenarios with new data. And I'll tell the Premier if we have to go back. But I also need the collaboration of the population, because if you all start walking around and going all over the place and not respecting the 2-meter distance, well, that is going to create quite the fire up. Mr. Premier, you yourself made a lot of precautions to not catch COVID-19. Around you, you have colleagues who have children who are going to be going back to school. Are they going to be able to work with you, such as was the case over the next few weeks? Are there changes on that? I haven't thought about that. Well, we apply the principle of social distancing. It's clear that if, for example, one of the ministers develops symptoms, the national director would tell him or her to stay far away from the Premier. It's the same thing for us. Our contacts are excessively rare in the community. And I think that we'll be keeping an eye on that. But anyway, we are trying. I mean, here we're a little bit closer because of the distance, because I can't be closer to this other person, but we spend very little time a little bit closer. And the Premier spends a lot of time in his office working from very early in the morning to very late at night. So I think that we'll be careful. But that principle of social distancing is major. And I can tell you, with the beautiful weather coming and, the impression that gives people, to get closer to others, it's not time to start hugging people. Mr. Premier, you touched upon it. The greatest concern is to maintain the integrity of the health network. The roadblocks, are they going to be maintained during this deconfinement period? Well, listen, the roadblocks will be maintained in a perspective of a population at very, very, very high risk of complications. But globally, and we could talk about it with Sécurité Publique, but we are going to be less in the constraining people. However, like anything else, if there is an evaluation of problems that could take place in what we could call interregional overflows that might be significant, we could do, like we do in other cases, we could put up roadblocks again. But right now we are starting to open things up. In these coercive measures, we're trying to decrease them. What will happen if at a certain time, when we open the schools within the two weeks, if 2 parents fall ill and the children end up in a situation with 2 ill parents, who's going to take care for those children? Well, we will see. Well, there will always be a way either of having the collaboration of the family or to have social services elements. It has to be said that if the parents do not have chronic diseases, etc., their child could go to school, and the probability that they suffer any complication is very low. That is why we ask first that the parents who have health problems that might both, for example, have problems, that they keep their child at home at this stage. But for those people who make those choices, there will not be any disadvantages from a schooling point of view, because approaches will be taken as well for people who will decide to keep their children at home. But the children who have learning difficulties, those children who have certain conditions that requires more help, we invite them, if people have no health problem, to send them to school. Hello. You have been recommended since last Friday to wear the mask when people are out. The use is already starting to be spread. It's becoming quite generalized. How to apply Act 21 that imposes having your face uncovered to have public services? Are you going to be asking nurses, teachers, police officers to not wear it, or does this law become cancelled out? No, I mean, we have an exceptional situation. People are going to be wearing masks for a certain amount of time, but Law 21 that asks not to wear any religious signs is going to remain. And last week, the mayor of Montreal, Valérie Plante, had asked for deconfinement that would be synchronized between the metropolitan area of Montreal and other regions. She wanted it to be done at the same time, even though the Montreal situation is more complex. What do you answer today to that? Well, it's science. I think that we are basing ourselves on science. We can see that the situation is very, very much under control in hospitals outside of the Montreal area. So I don't see why we would wait longer outside of Montreal. So as of the moment that the situation is different in Montreal from the rest of Quebec, well, automatically the confinement measures can also be different.
Patrick Belrose, Le Journal de Québec, Journal de Montréal.
Bonjour à tous. Première question pour Dr. Arruda. La semaine
A question for Dr. Arruda. Last week you mentioned that rather than 100 people right now at the Direction of Public Health in Montreal, there's about 800. Our information tells me that for the time being, there isn't a lot of work to be done necessarily in that department, and there's a lot of people who are in those teams, nurses often. So we're wondering why those people are not sent to CHSLDs to go help out. Well, listen, I think that we called out, when we say that there isn't a lot of work, there's still 437 cases that have been declared for which investigations had to be done. And when we start deconfining, as soon as there's a case in a workplace, we're going to require teams to be able to intervene. Those nurses have been mobilized. They have been trained for that kind of work specifically, and we believe that because, if we start, weakening ourselves by sending people outside and we are asked even to increase or double our capacity in those zones, that's part of the criteria. There's a criteria of testing people, that, the healthcare system be able to do something, and that the public health teams be able to intervene if there's any cases, contacts, and affected areas. And that can explode. It can really, have a surge from one day to the next, and we create a crisis if we can't mobilize ourselves. That is how we prevent cases to transmit to others and yet others and yet others, to avoid an R0. If the curve goes up and the hospitals be hit. And the situation in CHSLDs right now, it is being managed with other health professionals. All the people that we try to go get. So you can't, remove clothes from one person to dress another person, because then you'll end up with two naked people. Mr. Legault, we haven't seen the second wave yet in CHSLDs. Do you find that a little long, and are we sure that we're going to have the 1,000 militaries that have been promised? I was told that 400 military personnel should arrive here on Wednesday, so the day after tomorrow, and there should be another 275 that will be following, but we don't have the date yet. Beyond the 675 to get to 1,000, we don't have the date either.
Oui, bonjour. Vous avez, Monsieur le Premier ministre.
Mr. Premier, you indicated that we should not interpret the reopening of schools and daycares as, everything is over, we don't need to follow guidelines anymore. And earlier you mentioned, we can't have meals, we can have parties with elderly people. I think Dr. Arruda said that. But for it to be clear with everyone, over the next few weeks, over the summer, is it still that all inside or outside gatherings are forbidden? So 2 people or more of people residences, that's not possible. Yes, we want to keep that ban on gatherings until further notice. You will see tomorrow that there are certain indications that will be given over time in the course of the next few months. But yes, in fact, gatherings are forbidden still. Now, as far as the reopening of schools are concerned, I just want to understand correctly. In a school, say, there's one case, a confirmed case of COVID-19. Does that mean that you tolerate because children can get through it and the teacher, we'll see? Or do we say, no, we're closing down the school because there's one case of COVID? Well, first, our objective has never been to purposely infect a child or anybody else with COVID-19, so that everything that we can do, if there's a case like that in a school, to avoid that there be others who catch it, we'll do it. So we'll be consulting, there will be inquiries, there will be screening tests in the school, and we will take all the necessary measures so that people do not catch COVID-19.
Bonjour. Vous êtes pas sans savoir qu'il y avait déjà une pénurie.
You're not without knowing that there was already a scarcity, of course, of teachers in schools before the crisis even. Do you not fear that this lack is going to get aggravated with the absences and basically the problems that we had in CHSLDs will not be present in schools? Well, you'll be able to ask the question to the Minister for Education later, but I do believe that we have already started speaking with students in education faculties to possibly go get support if necessary in the future teachers. We can see that Quebec is the most affected province and that we are the first ones to reopen the schools. It may seem contradictory in the minds of people listening. First, we have to be prudent when we compare. We have often said that by association or by tests, we calculate every person who has died as having COVID-19, including in CHSLDs. It is not the case elsewhere. And we have to be prudent as well with provinces others than Ontario because, the great cities of the world are much more affected than any state where there is no great city. The key for a successful deconfinement is based on the number of screening tests that will be done to be able to evaluate and limit outbreaks, for example, in schools or businesses. Does Quebec presently have the ability to have sufficient screening tests to be able to follow the evolution of the epidemic in a deconfinement phase correctly? It has to be understood that Quebec has tested much more than other places, but we also had difficulties. I'm not trying to minimize it, whether it be with the swabs or the reagent that was inadequate. There were problems with, swabs that had to be sterilized. But right now we are on the right road. I think that we can go up quickly to 15,000 tests per day, very briefly, or perhaps even as of now, and we will be developing and testing. We'll continue testing right now where there are outbreaks, but then, to go check out what is going on in terms of community transmission. This puts an end to the French questions. English now.
Good afternoon. I'm just looking at, you have children aged between 5 and 12 years old going back to school, and you hope that the physical distancing will be respected. So can you tell us more about your hopes about this, knowing that you have the pressure to do things right? Ontario is keeping schools closed until the end of May. Mr. Legault. Okay.
But like I said in French, there are 5 reasons why we've decided to reopen schools. First, we had the support of health, public health. Also, I think it's very important for our children, especially for our children having learning difficulties. It wouldn't make sense to wait 6 months before they go back to school. It would not be good for them. And we think that anyway, in 6 months, there's no proof that we will have a vaccine in 6 months. So we'll be in the same situation as today. Also, yes, we're asking children to stay at 2 meters from one another. It's not always easy with children, especially the ones that are younger. But we also, and science say that the risks are very low, that they have consequences if they get the COVID-19. And the situation right now is under control in our hospitals. So it means that if something happened to the child or to the parent, we'll be able to take care of him or her.
Okay. And my second question is about testing swabs with this plan of reopening schools and then businesses, Mr. Arruda. Seems that there is confusion with the number of tests that we can do per day in Quebec. I see 6,000, I see 4,000 to 5,000, and then like a new capacity of 15,000 per day. So what is the plan?
This is 15 per day, and it can go up when we're going to have, I would say, the new type of PCR that is made on the side of the persons. We have bought the machines waiting from receiving the reactives. But actually, with the tests we are using to do, we can have 15,000 tests per day. And we will keep some, I will say, for trying to measure the activity in the community in our next days in relation with the opening of the society. But I just want to tell something, if I can, please. It's not because we are opening schools or I would say daycare centers that it means that the person at risk is not more at risk. So if the population thinks that because we open schools and I would say daycare centers, they can go out and as before, it's not the case. We're going to need that you stay home, especially if you are at risk, especially if you are over 60 or 70 years old, because if you just go too much outside, it's going to be at risk for you because there's going to be a reaugmentation of circulation in a lower level. But if it's a big level, we will have to come back to the confinement, which is what we don't want to see and have.
Thank you. To answer your question about swabs, we have 109,000 swabs in inventory right now.
Oh, you do?
Yeah, 109,000.
Thank you. Samuel Pouliot, CTV News.
About the schools reopening, how will the government and the public health deal with an eventual outbreak of COVID-19 in a school? Could you close the schools again, or how is it going to work?
That will depend on the situation. There is going to be probably kids that we're going to have the disease and have no symptoms at all. So, but if there is somebody with symptoms, we will detect him, see what is going on around, who is the teachers that have been exposed or not. And based on the situation and the specific story, that class could be closed for 14 days and not all the school. That really will depend on the specific situation. But the best principle is, first of all, we are keeping, as in industry and other sectors, the 2 meters principle. It's clear that you can have a 1.5 meters in a second. If you don't last all the day, that's not a big issue. Because it's clear that even us, we never always are at exactly 2 meters from that. But we will manage that as we will manage, I would say, an outbreak arriving in a workplace or somewhere else or in a family.
Okay, and on another subject, there's a worker in Montreal who was recently hired at CHSLD, and she was told this morning that she has tested positive for COVID-19, and she says everyone at the CHSLD looks like they have lost hope. How can you encourage people to go and volunteer and go back to work when they are at risk and the conditions are bad?
Okay, but like I said, we had last weekend 11,000 people who offer their full-time services to go in CHSLD. So right now, we're assigning them to different CHSLD, and we think that in the next few days, we'll be able to fill all the jobs that were open. So it will help for the difficulty of the job, because when you are short of staff, it's tough for the staff that is in this situation. Having all jobs that are filled will help a lot, and I thank even people like Joanie Rochette, and Laurent Duvernay-Tardif. I think they gave a good model, a good example, and right now we have enough people to fill all the jobs. So I'm very, very happy about that.
Thank you. The next question is from Raquel Fletcher, Global News, and it's for Minister McCann. The Conseil pour la protection des malades has voiced many concerns about CHSLDs, that your directives aren't being followed on the ground. Staff are afraid to speak out, and they denounce the fact that you are asking for all sorts of help from trained and non-trained people, but still some establishments are refusing to let in caregivers. Can you respond to their concerns?
Well, for the caregivers, we have discussed very much with public health, with Dr. Arruda, and we have already opened up a little bit more to caregivers, and we have another discussion today, at the end of the day, about the caregivers, because we really want to open the doors more. About the first element of your question, I want to say that this is something we've never lived in the health system, in the population and in the health system. It's an extraordinary operation. Our system right now is not the same as it was before. And we have done this in a very, very short while. And the operation has been improved and improved every day. And each time there is something not going well, we want to know it. As an example, we have now installed phone numbers for all the establishments. We are going to do this in the short term. If people don't have the protective equipment that they need, they'll have an emergency number in the organization. And we want to know it, actually. And what I want to say is to the workers to speak up and to tell their managers and to call and to let us know, because it's a huge operation. And of course, we want to adjust rapidly. That's what we've done. Every time we've known that something was not working out exactly as it should, we have really responded, and very, very quickly. So this is something I want to say, a message to everybody. It's a huge operation. Everybody is mobilized. We're doing everything we can. And if there are some problems that we don't know about, we want to know about it, and we fix it very quickly.
Thank you. The second question is for Mr. Legault. Have all 1,000 Army soldiers you ask for being deployed? Where and what are they doing?
Okay, we expect to have 400 Wednesday. We expect to have another 275 soon. And I don't know if we'll get more than 675.
Thank you. The next question has been sent by Phil Autier, Montreal Gazette. It's a question for Mr. Legault and Arruda. Saturday was a nice sunny day in Montreal. Lots of people were talking, biking, and enjoying the fresh air. In many cases, people were not respecting physical distancing. How will you ensure social distancing in Montreal as the weather gets nicer?
I think that's a challenge, and I want to ask, first of all, that the people do this because it's going to be part of the solution. I understand that with the night, we would like to go outside with the beautiful weather, but I think that people must respect the 2 meters, and I just hope that if we don't do that, we're going to have to come back on more coercive approaches. So, but I think we can, unless there is always exceptions, but I'm asking people, please keep your 2 meters distance in between you. And I know it's tough. Try to not go at the same time everywhere. But if we have new rassemblement in parks in Montreal, we'll see the way we're going to make it stop, because it's a risky situation.
Thank you. The next question is also for you. Montreal is the epicenter for the COVID-19 outbreak. Can you please describe what is happening in Montreal? How much is community transmission? What is the R0 number for the city now? How much the virus is among CHSLDs and healthcare workers? How many hospitals are affected?
In fact, good questions. The right numbers, I will go generally because I cannot, things are changing every day. But in fact, in Montreal, there is the situation of in Quebec, And especially in Montreal, there is the situation of CHSLDs that is having, which has had a big number of people who die, but it's calming, I think, actually, the people dying on those settings. There is not a R0 of under 1. It's up 1. It's not 2. It's between 1 and 2. We're going to follow up those things. This week is a very important week for us. It's why we are not opening on the 4th, but waiting for the 11th to make sure, and even to Montreal to the 19th to make sure things are okay. And there is some, I would say, there have been some control outbreaks in some hospitals that have been controlled, put into red zones, separating from the other ones. It's normal, I can say, especially with that new virus having asymptomatic people who can give the disease before they get symptomatic. It makes things more complicated for us. Don't you remember in January we thought it was only when you were symptomatic that you can give the disease. After it was 1 day before, and now it can be almost at 6 days before you get the symptoms. So that makes things more complicated. But the things are, I would say, in this case, I would say, under control, but there is still need to go down in the community transmission in Montreal if we want to reopen things.
What I would add on this, if you allow me to, that the situation in Montreal, as the Prime Minister is saying, is there to Quebec. The Greater Montreal is of course, a situation that is very different from the rest of Quebec, and the situation in the hospitals, is tighter. So we have to be very careful about the situation and follow it up. And also the long-term facilities that are in difficulty, still in difficulty at this point, are mostly in the greater region of Montreal. So of course, we're counting on the new staff that's coming in to help out.
Thank you very much. Juste avant de conclure, pour le bénéfice des...
Before concluding, for the benefit of our colleagues, would it be possible for you to specify the answer that you gave earlier on to a question having to do with the roadblocks? You said that we'll not be into constraints. Well, in roadblocks, when we deconfine, we start being less into coercion. You know, we try to let people have their own judgment. But if ever we realize that there's a very important moving around from one region to another, particularly a hot-cold mix, we'll see whether we don't have to reconfine. I know there will be questions and debates, and there will be issues as well, together with people's cottages and things like that. We are evaluating the situation, but you have to give us the time to see what's going on in the Montreal area right now in terms of community transmission before we make any informed decision. I know the questions will be coming. We'll see what date we'll decide on the sequence, but it will all depend on the elements. Because, you know, every time we add an element, it increases the risk, and we have to be able to measure that. That is why we even have, you know, details on people's, you know, work shifts in certain sectors that are going to be opening at 50%, say, to be able to calculate, using modeling, the quantity of people that may end up in close contact. We know that the 2 meters is going to be respected in businesses. That's major. We work that together with the SNEST, with the businesses themselves, etc. And if people do not respect that, they put themselves at risk of being closed. So I think that everybody has to be responsible and respect the prescription we are giving them. This is something that is very important to me. It's not because we're deconfining that the risk has gone. The risk is probably, you know, we've managed to not submerge our hospitals, but the risk remains. And it's almost as present as what we had in the spring. Thank you for this clarification. This concludes for today. See you all tomorrow.